So today we're going to talk about Down syndrome. What is Down syndrome, one would ask? Down syndrome, also called trisomy 21, is the most common chromosomal condition in the United States. A chromosomal condition happens when there is a problem in one or more chromosomes. Chromosomes are the structure that holds genes. Genes are part of your body's cell that store instructions for the way your body grows and works. So then we get down to what causes Down syndrome. Well, each person has 23 pairs of chromosomes in every cell in their body. For each pair, you get one chromosome from your mother and one chromosome from your father. Babies with Down syndrome have an extra copy of chromosome 21. As you can see from this example, they have an extra copy of chromosome 21. So how was Down syndrome discovered? The first differentiated from cretins by John Down, who recognized and grouped this set of children with similar characteristics as Mongoloids, implying that children had similarities in features to natives of Mongolia. Due to backlash from the Asian community, who took this name as an ethnic insult, the name was changed to Down syndrome. This name was shortened even further when it was introduced to the American public as Down syndrome. So what are your risks of having a baby with Down syndrome? At the age of 30, your risk is 1 in 940. At the age of 35, your risk is 1 in 353. At the age of 40, your risk is 1 in 85. At the age of 45, your risk is 1 in 35. So as you can see, as you get older, your risk for having a baby with Down syndrome go up. As you can see, people with Down syndrome live perfect normal lives, as you can see from this cute little girl. And as you see from this picture right here, they live perfectly good lives. They work, they bring home income. So one would ask, what are the types of Down syndrome? So the three types of Down syndrome are trisomy 21, mosaic Down syndrome, and translocation Down syndrome. So trisomy 21, this is the most common kind. In this condition, your baby cell has 3 copies of chromosome 21 instead of 2. With mosaic Down syndrome, it is very rare. People with mosaic Down syndrome may have fewer characteristics of Down syndrome because they have some cells with the 2 copies of the chromosome 21. Translocation Down syndrome, this condition is also very rare, and it can be inherited, passed from parent to child. So can you check for Down syndrome? Yes, there are 2 ways you can check for Down syndrome. The first way is screen testing. This test checks if your baby is more likely than others to have Down syndrome. There are no risks to you and your baby when you have screen tests. But they don't tell you for sure if your baby has a condition like Down syndrome or not. The second way is diagnostic tests. These tests tell you for sure if your baby does or does not have Down syndrome. If a screening test shows your baby is high risk of Down syndrome, your provider may recommend a diagnostic test to confirm the results. This is my works cited. Thank you for your time and have a wonderful day.